A Metro Atlanta father lost his wife during a scheduled C-section. The couple was looking forward to welcoming a second child. As we recognize Black Maternal Health Week, reporter Valencia Jones shows us how the widower is coping with crisis.
We walked into Cedars-Sinai Medical Center in Los Angeles, California, for what we expected to be the happiest day of our lives, and walked straight into a nightmare.
Charles and Kira Johnson were ready to welcome their second son, Langston, on April 12, 2016.
Langston was born perfectly healthy. Kira was taken back to recovery, and I noticed that there was blood in her Foley catheter.
He says the medical team ran several tests and said they planned to do a CT scan.
My wife was allowed to bleed internally for more than 10 hours at the hospital while we begged and pleaded for them to do something. When they took her back to surgery, there were 3 liters of blood in her abdomen, and her heart stopped immediately when they opened her up.
The happy, adventurous wife and mother, he says, was full of life, gone at the age of 39, leaving Johnson in shock and beyond grief.
I began to hear these stories of other families that had these horrible birthing experiences. That's why I began to do the research for myself, and I came to understand that we are in the midst of a maternal mortality crisis right here in the United States.
He later founded the Atlanta-based nonprofit For Cura for Moms.
Our goal is simple: to make sure that every mother in this country has a safe, dignified birthing experience, and to eradicate the maternal mortality crisis, full stop.
He joined forces with the nonprofit Black Mamas Matter Alliance for the 7th annual Black Maternal Health Week campaign. The event drew hundreds of people, showing solidarity for the mission.
In our state of Georgia, we have one of the highest maternal mortality rates. We also have a very high infant mortality rate and preterm birth rates in the state.
Their mission includes changing policy and driving research to help mothers to thrive before, during, and after pregnancy. In the meantime, Johnson and his 2 boys continue to honor Kira's legacy.
Kira had this thing that she would say to me when she was proud, and she would say, "Go, baby, go." And I think that's what she would be saying right now is, "Go, baby, go."
For information on these organizations, visit forcuraformoms.com and blackmamasmatter.org. Valencia Jones, Atlanta Now News.
Thanks, Valencia. And we have more information on this important story. Georgia has the 2nd highest maternal mortality ratio of any state in the country. That's according to America's Health Rankings. Only Louisiana is worse. And from 2015 to 2017, there were about 69 pregnancy-related deaths and roughly 25 related deaths per 100,000 live births in the state. That's from the Georgia Department of Public Health. The department says 87% of the deaths were preventable. In Georgia, Black women were more than twice as likely to die from those causes than white women.